Hello, and welcome back to the next installment of The Endo Adventure with me, Emma, chronically ill person. To catch you up from my last video, which is where my MRIs were cancelled, and no one called me to inform me, so I found out on the day of showing up at 7 a.m. Yeah. So, that happened on a Wednesday. Did a lot of calling, did a lot of messaging, did a lot of reaching out to the people who could hopefully solve this for me. Didn't really get a response until the following Monday, where finally I had several people calling me throughout the day to be like, that was a mistake, so sorry. Let's get you rescheduled. I'm like, cool, today's Monday. Tomorrow, Tuesday, I'm supposed to have my MRI findings appointment with my doctor and also to have our pre-op surgery consultation where we talk about the things we're cutting out of my body permanently, okay? So they managed to get me rescheduled for exactly 2 hours before my appointment. And if you have ever needed to have a scan for anything before, usually when it comes to like a CAT scan, MRI, anything like that, you don't get to find out what showed up on those scans immediately after. Usually it takes a couple days for all of the weird red tape to happen so that your doctor can have time to look at it, analyze it, and then call you. So I was going to have my MRI at noon. I was going to meet with my doctor at 2, and the hope was that those images would be fresh off the presses and we could just look at them together. What could go wrong? So the hilarious part about the MRIs is that I've had several MRIs before. I know what to expect. The machine is loud. You are stuck in a tube. You gotta stay still. It's a little weird, but it takes between 20 and 40 minutes depending on what they're doing. It's fine. You will survive. The nurses were wonderful at this particular location, and the radiology techs were great. They were lovely. But so many things went kind of like awkwardly wrong during my MRI appointment that it just felt like the universe continuing to play jokes on me. So here's what happened. I get there, and they definitely tell me ahead of time that, like, I'm not allowed to have anyone come with me on account of global crisis in the form of a pandemic. So all hospital buildings, pretty much everywhere, are instituting the no unnecessary bodies in the building rule, meaning I can't just have a visitor come sit in the waiting room with me. It needs to be just me, the person having the procedure. I get up to this waiting room and literally everyone next to me has their like sister, spouse, mom, best friend, whoever just sitting with them. And it's not like I'm assuming that. They were talking about it. The people who brought their people. And I'm just like, oh, cool. Yeah, my partner's in the car, in the parking garage, waiting on me to be done. How did you people get in here? I don't understand. Why haven't they told you to go home? They bring me back. They tell me to get changed. I put on the amazing hospital gowns. They give you 2 because they're sort of like wrap garments, but they don't completely cover you. So they give you 2 and tell you to put one on the back way and then one on the front and just kind of tie them all together. And one of them definitely had a slash across the chest, like it had been ripped in the washing machine or something. So I decided to put that one over my back so that my back was just hanging out. Very elegant, backless, early 2000s moment, right? I then go to get the actual MRI done. I walk in, they are great. They've got the pillows and like the little kind of triangular wedge thing where your knees go over so that you can lay down flat. They've got the headphones, they play music for you, whatever you want. It's amazing. I request Christmas jazz because why the hell not? And we get I get laid down. They put the IV and all that good stuff in my arm because we're doing an MRI with and without contrast, meaning they gotta pump me full of some fluids so that things show up on the scans, push me in the machine. And I start noticing pretty quickly that like nothing is coming through the headphones. I'm not hearing Christmas jazz at all, which is just so tragic, right? In addition to the lack of music, I start noticing that my right arm, the one that they have put the IV into, so the needle is in the crook of this arm, and the little tubing kind of snakes over my arm and out and around the tube, is starting to kind of go numb and hurt. And it's because the way I was laid on the sort of like board when they push you in, it's literally a tunnel. The MRI is a tunnel, you guys, if you've never done it. So this isn't dirty. Relax. You're on this board and it goes through this tunnel, okay? And so my head and shoulders were out here and the rest of my body is like in the tube. And I'm just noticing that like, I'm scooched over a little too much to the right. My right arm is pinned inside the machine. And I can't hear my Christmas jazz. Now, before they pushed you in, they give you this little weird egg-shaped squeezy ball thing that has a cord attached to it. It's the call button, and you squeeze it. They leave it in your hand so you can easily squeeze it if you need to, and that's the call button. It alerts them that something's wrong and you need to be pulled out of the machine. And I was just kind of like, alright, well, the girl who has anxiety is like shoved in this claustrophobic little tube. It's so fucking loud with the machine going around taking pictures of my pelvic and abdominal region. I'm trying very hard to keep my eyes closed and to keep my breathing steady, but I get pretty dysregulated from auditory stimuli. That's a thing I learned about myself in 2020. I have auditory dysregulation with some sounds, and so having headphones on and music playing really helps, except I can't hear the music. It's not coming through the headphones. And I'm just thinking, you know what, Emma, you're gonna be here for like half an hour. Just press the call button and tell them you can't hear the music. It's literally why they give it to you. So I squeeze the call button. Nothing happens. I squeeze it again. Nothing happens. So I'm just inside this machine that is very loud with no Christmas jazz in my ears. The call button apparently seems to not be working, and my right arm continues to just start to burn from how numb it's getting and is just radiating pain up my shoulder because it's pinned in the machine. And finally, this is how you know you're an anxious person, where you start laying there in pain, in a lot of discomfort, and it already took a lot of energy to get me to even squeeze the call button the first 2 times, and I just start thinking, can I just survive this with no music and with my arm feeling like it's slowly disconnecting from my body? Can I just deal with it rather than making a fuss? Because my next option is going to be trying to raise my arm and wave at them out of the machine. If I can even move my arm to do that. And so I start just being like, no, obviously, don't do that, Emma. Alert them that something is wrong. You're in pain. You can't hear the music. The call button's not working. And so I just started squeezing the call button over and over again. Eventually it got through. They did pull me out. I readjusted. My arm felt so much better. They turned up the music, but it was still barely audible in the headphones. Pushed me back in. They tell me that they're going to start the contrast. I feel the coldness that they describe. With a CT scan, the contrast feels hot. It makes you feel like you have to pee. Just for your information, with the MRI, I literally felt the liquid squirt up the back of my neck, like go through the veins and the things that connect the cardiovascular system in my body. And I felt the squirt like back here, which was super strange. And it's cold, like in my veins it's cold, and yet I'm just feeling something weird inside my right elbow, which is where the IV is attached. The needle actively is in my skin, inserted into my flesh, and something feels weird. It feels like it's leaking, and I'm thinking, nah, it's probably just the cold effect making my arm feel kind of funny. No way it's leaking. Spoiler alert, she was leaking, friends. They finally tell me I'm done. They pull me out. I go to sit up. They try to disconnect the IV, and it's just gushing down my arm. I don't know what happened. I tried telling them, look, it's just running down my arm. It's clear liquid, so you can't see it super obviously unless you're like looking to see like the droplets of just like liquid that are just starting to, like when you go to brush your teeth or wash your face or something and the water droplets run towards your elbow. It's that, but in reverse. So they're trying to wipe me up and they keep missing like the trail on the back of my arm, and I'm like, it's like still leaking. Like I don't, you disconnected the thing, but like the port here itself is still leaking. So anyway, they take out the needle, they clean me up. I go get changed. I leave. I meet my partner down in the parking garage where he's been sitting playing on his Switch in the car. And we go get fast food. On the way to the doctor's office so that we can look at the images they just took. Wow. Quite an afternoon. Yeah, definitely the most eventful MRI experience I have ever had. When you say it all together, it just sounds really shitty. It just sounds like an absurdist piece of theater, right? Oh, just figures. It just figures. Anyway, we get to the hospital to go see my doctor for my pre-op appointment. I'm in pretty bad pain at this point. I'm sitting in the waiting room, like struggling to be able to sit in the chair comfortably. The nurses are noticing that I'm sitting there uncomfortably. I'm the only one in the waiting room, masked up and everything, of course. And they're noticing that I'm sort of doing one of these in the chair because it hurts to sit up straight. I finally get back. Funnily enough, normally they have to take my blood pressure twice because the first time it's always high due to the fact that I have a panic disorder that causes me great anxiety anytime I go into a doctor type situation. And so usually they have to wait a few minutes and then take it again. And by that point, my nervousness will hopefully have calmed down enough that my blood pressure will come back normal. So it doesn't look like I have more problems than I do. Amazingly, they only had to do it the first time. Apparently me being so focused on being in pain actually counteracts the anxiety, and so my blood pressure just looked normal. Even while I'm sitting there crying. Oh. Doc comes in. We spend a few minutes looking at the MRI images he just got, and he's explaining to me that he just got these, so we're looking at them together for the first time, which he said is, of course, unusual because usually he has a few days to like sleep on it, really let his brain kind of absorb and like make plans about what we need to do for surgery, but we're kind of just going with the flow. So he shows me everything that's going on, and Strangely enough, I have a few things that show up on the MRI, and I say strangely, but no, this is what we wanted. I wanted the MRI to show the demons erupting inside my abdomen because for so many years I have had such horrible pain that has never shown up on scans, never shown up on ultrasounds. Of course, it's not going to show up on a basic x-ray. And with endometriosis in particular, you just can't see the breadth of the disease unless you are physically looking inside the body through some kind of surgery. And the MRI is mostly just an extra diagnostic tool. It's kind of the most complete imaging that you're going to be able to get because it takes like a 3D picture of whatever part of the body you're photographing. And what we were hoping for was that some things would show up, because when you are chronically ill and you're in pain all the time and people keep telling you that there's no reason you should be hurting because your scans came back fine, it's the worst thing you can be told in the world. You want bad stuff to show up on those scans so that it feels validating, so that it's a reason. Finally, there's something you can point to. You can blame it on something. Oh my God. It's so important to be able to point and say, this is the problem. How do we fix it? But when the problem is a ghost, how do you fix that? So, a couple things showed up. I apparently have an umbilical hernia, which I've never heard of before, which is interesting. On your abdomen, you're supposed to have like the abdominal wall. So like imagine that your belly button is out here, and then you've got like the fat and muscle tissue, and then like all the gush and organs in here. The musculature is supposed to go just straight up behind the skin, but for me, it sort of does this weird like cutout point where the gush part has kind of like been shoved up against the back of my belly button, so the muscle stops, belly button gush connection, and then continues after it, which is not how that's supposed to be. He asked me if I had been having any pain in relation to this, and I'm like, no. He asked me if they used my belly button as a port site for the surgery that I had back in 2008, which is exactly correct. They did go in through my belly button. So I don't know if that has something to do with it, but clearly the tissue kind of got pulled up against the back of my belly button in a way that it wasn't supposed to. And it can cause problems for some people. So he's gonna fix that. Unexpected, interesting, weird. We love it. The next thing, he goes through and he's showing me the pictures and he's like, here's your uterus. Your uterus actually looks beautiful. And I'm like, stop with calling the literal demon of my body beautiful. I've had so many doctors this year tell me that my organs look beautiful, the picture of health. Clearly they're not, and they just watch beauty gurus and know how to cover their faces really well. So look underneath, friends. In addition to my beautiful uterus, however, my left ovary has been completely taken over by a cyst. I am planning to get the copies of the MRI images. I wish I had taken a picture when he showed it to me at the time, but I was just kind of staring at it aghast. So if you can imagine that, like, here's my body. So like here's one side of me and here's the other side of me, and all of this is sort of the MRI image of my organs. We've got like intestines and uterus and all that happening, and like front and back of myself. Right over here is just an egg, a massive white egg on the scan. Everything else is sort of shades of gray, which is what you want because that's just how organs show up on scans. And then we just have this solid white mass that is about the size and shape of an egg that has grown inside of my left ovary. So we're gonna deal with that during the surgery. I've been petitioning my friends to come up with names for her because we need to name her. Clearly she is loud and proud, and she deserves to be known. So, additionally, we talked about a few things that we may do during the surgery. He may go ahead and do an appendectomy, removing my appendix. Apparently, for a lot of endo patients, the appendix can be a site for lesions and inflammation and all kinds of things. And if it looks iffy at all, he'll just go ahead and remove it, because why leave it to potentially create problems down the road when you don't need it? We had a very big conversation about hysterectomy, because even though my uterus looks beautiful on the MRI, that doesn't necessarily mean that it's not covered in endo when he actually goes in and can see it with his own eyes. It doesn't mean that it's perfectly healthy. It just means that on the scan, it doesn't immediately look like it is deformed and misfigured. While I was in the office, we tried what is called a paracervical block, which is where he does 2 injections basically into my cervix. Yeah, ow. To numb the uterine nerves. And it essentially is meant to mimic the feeling of having had hysterectomy, where if your uterus is causing you any kind of pain, these injections numb all of the nerves associated with the uterus, and it lasts for a few hours. And if you can feel a reduction in your pain at all, it can kind of tell you, as the doctor said, it can kind of give you really valuable information as to whether or not a hysterectomy will actually significantly reduce your pain levels. And obviously, this is not a one-size-fits-all thing. For some people, it can be an immediate, huge, massive effect of, oh my god, all of my pain is gone. I've never felt so amazing. For some people, it can feel like nothing has happened and they can't tell at all. For some people, it's like, it's lessened a little bit, and then as soon as it wears off and a bunch of their pain comes back, oh yeah, I can definitely tell a difference when it wears off and it all hits me. So we were trying that out just to see if it made any difference. Here's what I will say. I was really concerned about having surgery with this doctor without ever having had him do an exam, a physical exam with me. My very first appointment that I ever had with a gynecologist was with my mom's doctor, who was also male. The only other male doctor I've ever seen. He was the one who gaslit me and ignored me for about 4 to 5 years. Continued to put me on different forms of birth control that weren't really helping to manage any symptoms. And finally, when he agreed to do the surgery, was just sort of like, oh yeah, she's got endo, but didn't give me any information as to what stage I was in, as to how we were gonna effectively treat it for the long term. He just did the ablation, which is essentially where he burns off the front rather than actually dealing with the root, so it can create scar tissue and it can spread and it can grow back, which is why excision is the gold standard now for people with endometriosis, that you need to actually scoop out the disease and remove the entire thing. You're not going to tell a cancer patient full of tumors that you're just going to leave the tumors there and it'll be fine. Take ibuprofen and call you in the morning. That's not what you do. You go in and you remove as much of it as you can, if not all of it. So that's what we're trying to do. Anyway, because this is the first male doctor that I have had since that experience over 12 years ago, I was really concerned about how anxious I was going to feel with him doing the exam. Exams are pretty painful for me regardless. I have pretty high levels of anxiety and from my post-traumatic stress disorders anyway, but it overlaps with that trauma. If you've got a history of sexual violence at all, going to the gynecologist is not going to be a fun thing. It can feel really uncomfortable, and even if your body is healthy, your brain can be telling you that there's something to be afraid of, and so the exam can hurt because you're tense and it's hard for you to relax. And speculums are not cute, y'all. So I'm just gonna say it. Because he ended up doing this paracervical block, he did need to actually insert them into my cervix, meaning that he used a speculum to open my vaginal walls so that he could stick in the needles, which are like this long, by the way. You're welcome for the imagery. And it was just kind of a rough exam. It was really painful. My entire pelvic floor and all of that infrastructure surrounding my vaginal walls were just like screaming in pain. I was already in pain before this, but it was a little bit of a rough exam. I usually have the doctors that I've had in the past have been a little bit gentler handed with me. It wasn't anything egregious, but it just definitely was, there was an edge to it, you know, and it makes me, like, what do you do? When you are afraid of being able to get that kind of attention and care, and you've said everything you can, and it's still not quite sinking in for someone, it's like, how do you adequately express, like, dude, everything hurts and I need you to be so much more gentler than you're being. It's hard to express all of that. It is hard to express all of that. I'm planning on doing a whole kind of series about advocating for yourself when you are dealing with medical professionals. So we'll get to all of that nuance later. But I sit up, my entire pelvic floor is aching, so everything that is holding me upright, everything that I'm using to like sit on the exam table is just throbbing and in pain. And he's like, "Do you feel better?" And I'm just sort of going, is it that immediate? Like, I don't know. I've never had a paracervical block before, and this is when he kind of explains, well, you know, usually it can take a few minutes, but it's fairly immediate. You may or may not experience like immediate pain relief, but over the next like 20 minutes or so, you should be able to tell some kind of a difference. It may honestly be after a few hours when it wears off that's when you feel all the pain come back, and maybe it feels more obvious when the pain returns versus it kind of like slowly dissipating in the beginning. It's also not necessarily going to solve all of your pain. So obviously you have pain coming from the cyst and you have pain coming from these other areas. So like this is literally just the uterus, and I'm like, great, cool. Right now I can only focus on the fact that my entire pelvic floor feels like I got just punched with metal, because that's sort of what happened. We start talking about the hysterectomy and kind of what that would entail. Having a hysterectomy is a much more in-depth procedure than just the initial exploratory surgery, because they will be actually removing an entire organ permanently from my body. So it will take me from an outpatient procedure where I am there for just a section of the day and then I get to go home once everything's done and they make sure I'm fine. I will need to spend at least one night in the hospital. So I will be there for the 5:30 a.m. call, spend that whole rest of the day and the night into the next day at the hospital, at the very least. And hopefully nothing goes horribly wrong, causing me to need to stay there longer. But that does mean that because it's COVID times, I'm going to be alone in the hospital for those 2 days. And that is freaky to think about. Am I going to have to sleep in my face mask? I don't know. That's a question I'm going to need to ask him. Because I'm going to have it on the entire rest of the time I'm in the hospital. Like, how do you prepare for how do you prepare for a hospital stay? And this is so small potatoes compared to some people who have had to be in the hospital for similar and other issues, and then also for COVID itself during this time, who have been in the hospital for weeks or months or however long. It doesn't compare in terms of how intense that is, but it feels very large for me to kind of conceptualize right now. So I'm just sharing those feelings. Ultimately, I sign the paperwork. I leave the appointment feeling kind of weird. I don't know. This particular doctor, like, I just don't know that he and I are, like, gelling in the way that I would want us to. I do think that this encounter was a little bit better than our initial one. But he is just definitely not giving me that emotional kind of support, like the compassionate care that I've gotten from so many other doctors that I have met. And it's funny because I've met, I have had so many different doctors across the last 15 years of my life that there are some who are so compassionate and amazing, but who literally just don't have the knowledge to be able to help me, or don't have the resources to be able to recommend me to, like, where I need to be going. Or because I was traveling, I only saw them the once, and maybe if I had been able to stay in that particular area, if I was living in that particular place, I would have really consistently amazing compassionate care with that person. But because I was traveling for work, I was in that city for 1 week and I saw that person that one time and it was great, and then never again. And then there are other people who I've seen for months on end, and it's like, I don't know that this is the fit. You seem to not really get it, or you're not really helping me actually achieve anything, or we're trying all these different medications, but it's nothing that's actually strong enough. So I don't know. I am fully aware that there is a particular emotional component to my doctor's visits with regard to my reproductive health and everything that surrounds my chronic illness that I need and I'm just not getting right now, and that does weigh kind of heavily. It makes me nervous that I'm making a decision that's maybe not the best one or not the right one. This doctor is not the most compassionate, but he's also the only one who has been able to act so quickly. I've only met him twice, and we've already got surgery on the books for less than 2 weeks from now. 2 weeks exactly from today, actually, I think. And it's been so hard to get medical professionals to, like, okay these procedures to get me what I need in order to get the diagnosis, in order to get the care, in order to get whatever. And I'm struggling with the fact that, like, I don't feel like I know him, and I don't feel like I trust him in that way. We just don't have that connection. And, you know, the kind of, like, rough administration of this injection was a little difficult, you know. It makes me wonder if it's just the fact that, like, he's just going about his business, and for other patients that maybe what he did wouldn't be painful, but because my body is the way that it is, because my stress responses are the way that it is, it's so much more painful for me. It might feel like nothing for someone else, and then for me it's going to feel like everything. And so it's not even that he did anything wrong. I don't think he did anything wrong. There was a female nurse standing there watching him the whole time. I don't think that he physically was doing anything incorrect. There was just a certain amount of kind of grace and nuance and gentility that was missing, I suppose. It makes me wary, you know? Makes me worried about the road ahead and whether or not this is the person I want to continue seeing, and how successful my surgery is going to be. So, with regards to the paracervical block, I did notice a few minutes after I got dressed and left the office and walked back down to the parking garage where my partner was still waiting for me patiently while playing on his Switch in the car, that I was having less trouble standing and walking and sitting than I had coming into the office, I still had the pain that seemed to be centered around where my left ovary is. I was still having that pelvic floor pain, but that sort of central low abdominal pain that is kind of associated with being right in front of the uterus didn't seem to be as bad. And it was kind of amazing. We went to Walgreens to pick up a prescription, and I was able to walk around Walgreens and not cry, which is kind of astounding. A few hours later, around 7:30 p.m., it all hit me at once. All of the pain came back. It felt as if a bunch of wooden spikes had all been driven like that into my abdomen all at once. So it sort of signaled to me that, yeah, the hysterectomy might actually be quite helpful. So I sent my doctor a message to let him know about that. So we have started going back and forth about the particulars of doing the hysterectomy, that he would also remove my cervix, which I've been doing a little bit of research, and the specialist that I've been wanting to see, that is too expensive and that I don't know that I will ever actually get to see because it's cost prohibitive. On their website, they like to try to preserve the cervix as much as possible, and so I was sort of nervous about, like, well, is taking my cervix too much? Should he try to leave it? Like, what's happening with all of this? I don't know. I'm trying to learn all about it. Obviously, Calvin, my partner, and I have started our strict quarantine where we are not seeing anybody or really doing anything, and trying to get all of our groceries and things delivered leading up to the surgery, because I will not have this thwarted by taking a COVID test and finding out that I have somehow contracted COVID, because that will immediately destroy my ability to have surgery. And I will not do that. So that's where we are. The most ridiculous, insane MRI process ever. A little bit weird and kind of painful experience with the doctor, but finding out about some strange things going on in my body that need to be handled and dealt with. We, of course, talked about a few more issues than what I enumerated here, because a lot of that's just going to be based on what he finds when he gets in there. So it's possible that there are things that didn't show up on the MRI. We went through kind of the whole gamut of, like, potential things that they could find, the risks of bleeding that could happen, and all of these other things. He did enumerate with me how many people he was going to have in the room. I appreciated that. The thing I need now is I just want him to be super specific about, like, what he's doing in my body. That helps me to feel informed. So we are going to try and have another visit, probably virtually through telemedicine, before the surgery, to discuss the fullness of the hysterectomy and all of that good stuff. I've been making a list for my surgery go bag that now I am updating, because if I'm going to be spending at least one night in the hospital, I really want to make sure that I have every single charger I ever needed in my life, some earplugs, headphones, a sleep mask, the comfiest clothes, a change of clothes, a book, all of these things. Snacks? Should I bring snacks? I feel like I should bring snacks. I don't know. So maybe I'll do a separate video going over my go bag. I probably will. But yeah, that's where we are for now. It's emotional. It is super emotional. It is the feeling of having a few hours where the pain was less, not gone. Certainly it wasn't gone, but where the pain was just a little bit less. And then having it all rush back kind of all at once as the drug wore off. It makes me excited to go through with this. It sort of bolsters me. I want to do this. I want to be better. I want to be healthier. I want to be well. Oh God, I just want to be well. I have some thoughts about the hysterectomy that I will probably put in a separate video. A few friends and I have been talking about it. My best friend since childhood asked me, how are you feeling? And I feel okay. Mostly sort of wide-eyed over the concept of being pain-free in any capacity. That's kind of taking precedence over anything else. I've been decided that I'm never going to be pregnant or give birth through my body ever. That has been a decision that I made a long time ago. And I mean, if you can imagine, over half my life, my reproductive system has been this site of pain and misery. I have no emotional connection to my womb. The only thing that I might be lamenting or that I might be grieving is sort of the sociocultural stuff about those expectations of motherhood and of family and of so much concentrated attention is put on a woman's ability to carry and have children. And I don't buy into that bullshit for a second. And I encourage everyone else to also not buy into that bullshit. But it's interesting. I mean, ever since I was 20, I've gone through all of those steps of that process of grieving. So at this point, it's just grieving that last little bit of like, the life that I had before. The life of me being in pain every single day. Maybe this can help. It's hopeful. It's nervous, it's cautious, but it's optimistic. Cautiously optimistic. So, what I'm telling you right now, I cannot wait for the next Karen or Susie who comes up to me and says, "So when are you having children?" Bitch, I do not have a uterus, okay? Thank you so much.